So first of all, I think people have a thought that if someone doesn't have insurance, it's because they don't work. And that's not true. First of all, if you have a small business under a certain number of employees, you are not required to provide healthcare insurance. Secondly, healthcare insurance is expensive. And therefore, individuals sometimes have to make the choice to not pay for insurance. Maybe they've had an opportunity to have it at one point, maybe through a family member that's working, and a family member loses their job, and now that they don't have insurance anymore. There are various reasons that people don't have insurance, but the biggest misconception is that they don't work, and that is furthest from the truth. We can give example after example of working individuals who just don't have insurance. And so that's why we want people to not feel embarrassed by coming to our health center, because we're here to support and provide excellent care for them, just without insurance.
Yeah, and I can see how that label could be seen as negative, but it's really you guys are just helping the community out. And there's one thing where you could even be changing jobs, and you could be in between insurances for say a month or two, and you need to be seen. And a
That's
lot of people will just wait,
That's
right?
a great example that sometimes those things happen. And just like we mentioned with chronic illnesses, you definitely do not want to wait. If you're having issues with high blood pressure or diabetes, those things need to be dealt with. I can tell you in the last couple of months, we've had one week in particular where we had three patients who came in to see us, and they had delayed seeing a doctor, delayed seeing a provider, because they just thought they would get better. All three of those individuals had to be admitted to the hospital because they were severely sick. And I'm glad they came in to see us and that we were able to get them in to the hospital to get them taken care of. But you can understand how those things can really creep up on you if you don't get care. And so it's a great example that somebody might be between jobs, and in that in between they don't have insurance. We still will see you if you don't have insurance. Then when you get insurance, you can go back to your primary care provider, but don't miss the opportunity to get care just because you don't have insurance.
Yeah, it could be a lot more important than you think. Definitely.
Absolutely.
So your clinic or your organization is really bridging the gap between what we were just discussing, having insurance and not having insurance. And so, are you guys working with local businesses as well, or just individuals to make sure that everyone's getting seen?
So opportunities like this, certainly to get the word out, is really important. And Swept Away is an incredible partner of ours. And so we appreciate that they recommended us for this time to be able to come on and talk about what we do. So word of mouth is really important. Businesses knowing about us and informing their employees. I had an HR director at a company that provides insurance reach out to me and say, sometimes people through various reasons choose not to get health care when they become employed by us, or maybe they don't realize the timing of how, quickly they have to make those decisions, or they miss an open enrollment period for various things. How can you help us? It's like, well, of course, let them know about us so that we're here to care for them and bridge that gap in between the time that they become employed, or they're waiting to be employed, until the time that their insurance kicks in. So we're here for we're here for everyone that meet that need. If you have insurance, although we provide excellent care, you'd probably love to see our providers. We don't want to duplicate service. So children always have access to care somewhere. Adults don't. And so that is why we focus on adults without insurance.
Okay.